My name is Robert Bissonnette. I'm a dermatologist based in Montreal, Canada, who has had a long-standing interest in chronic hand eczema. This is my disclosure slide. Hand eczema severity. This is an issue that right now is becoming more and more important. It is something we're more and more interested in because there are more and more drugs currently being developed for the treatment of chronic hand eczema. However, this publication, which dates back now to about 11 years, looked at articles that were published with methods to quantify hand eczema. What they found was up to 2009, out of 69 articles, there were 45 different methods used. If we would do the same today, we would probably find similar issues. There's a lack of good standardized measures, validated measures that are part of a core outcome that is used in every trial in chronic hand eczema. There are some good measures, and I'll review some of them with you, but there's really a need to try to standardize what we use in the various trials. One of the reasons why I think this is happening is that in the US, we have no drug that is currently approved to treat chronic hand eczema, and we have very few that have been approved ex-US. So on the bright side, in my opinion, hand eczema is easier to evaluate in terms of severity, easier than atopic dermatitis. Lesions are located on hands only. This is what we measure. There is no interference with hair, clothing, folds in obese patients, less lighting effect. However, morphology can be fairly different for palms and the back of hands. In addition, there's a higher diversity, if one could say, of lesion type as compared to atopic dermatitis. These are the main measures I'll be reviewing with you today. One measure I won't be talking about, but it's a very important measure, is pain and pruritus NRS. So the typical scale that is used nowadays is a 10 grade from 0 to 10 NRS or 11 grade to measure pruritus and pain. This is very, very important, specifically pain for chronic hand eczema. I won't talk about it because it's fairly standard and well known by most people doing research or seeing patients in that area. PGA, IGA, big issue. This is the PGA scale that was used in the studies that led to approval of valetretinoin. This is an interesting PGA scale that combines both severity of lesions, you can see, to area of involvement, to symptoms, because we also measure pruritus and pain. The issue is that this PGA scale cannot be used in phase 3 to get approval of a drug in the US because it, one, combines signs and symptoms. Two, it's very focused on area. And three, the various grades don't have a specific descriptors for each of them. There's an issue in terms of IgA and PGA to evaluate chronic hand eczema because there's currently no validated good IgA or PGA scale that will be amenable to be used as a primary endpoint in phase 3. This is changing. As you know, many drugs are currently in development for chronic hand eczema, and there are scales that are currently being developed and validated. So in the next 2 years, we'll probably see a number of those published validated scales. And these are the ones that will probably be used in phase 3. One thing that is interesting about PGA for hand dermatitis is it's fairly easy to take photos in order to create photonumeric scales like this one. HEXI, or Hand Eczema Severity Index. This is the most widely used scale to evaluate chronic hand eczema. It evaluates 5 different areas: fingertips, fingers, palm, back of hands, and wrists. 6 signs are evaluated on a scale of 0 to 4, and surface is evaluated as well. This is typically a grid to evaluate HEXI. It's a bit reminiscent of EASY and PASI, where we have the areas, the different signs, and then the area involved that you also need to select. Very interesting tool, gives a lot of information on the severity and the location of severity for a given patient. In my experience, it takes a little while for a dermatologist or an evaluator to really feel comfortable using the tool, but once you're comfortable, I think it's very good. One drawback of this tool and most of the easy and PASI tools is that it's not that sensitive for patients with limited body surface area involvement. And if I can draw your attention to the fact that in order to go from 1 to 2 in the extent, you need to have an area involved with hand eczema of more than 25%. Validation has been done with this scale. There's been an effort to look at intra-observer differences. On this slide, you can see that the ICC for intra-observer variation was very good, usually higher than 0.8. For intra-observer, we can also see that there's a very good correlation in terms of patient evaluation. MTLSS, or Modified Total Lesion Symptom Score. MTLSS has been used in phase 3 trials with alloretinoin. It has not gone through extensive validation like HEC-C. It's very different from HEC-C and IgA-PGA because it's the evaluation of only one area of one hand. So in order to do MTLSS, the investigator needs to select the most affected side of the most affected hand. It's more a target lesion type of evaluation. What is evaluation? What is evaluated? You can see on this grid, erythema, scaling, lichenification, vesicles, edema, fissures, but also pruritus and pain. So it's a combination of signs and symptoms. Again, this could not be used as a primary endpoint in phase 3 studies. One thing that I like about this scale is that it provides clear descriptors for the various severity parameters, and it's fairly easy to use by investigators that are starting to do trials in chronic hand eczema. This, I think, is an interesting endpoint in smaller proof of concept studies. Could be added in phase 2b and 3 as well. Hand eczema extent score, a different scale that is looking at extent. So this scale really provides a lot of granular information on where the lesions are located. You can see on this figure. The way this is done, the evaluator needs to look for thumb, index, middle finger, ring, little finger, and indicate if yes or no, there's involvement of chronic hand eczema on all those areas, back of finger, side of finger, underside, etc. So it provides interesting information, specifically if combined with HEC-C, to try to get a good idea of what the patients are when they start the study in terms of severity and how it evolves over time. Some validation has been done. On this graph, you can see that patients can also use this, and even though there's no perfect correlation with dermatologist evaluation, it's not so bad. There's been some validation in terms of intra and inter-observer reliability, and ICCs are fairly good. Quality of life. So quality of life hand eczema questionnaire. This is developed in Germany, validated in several other languages, but some of the major languages, from what I know, still have not been validated. The questionnaire has not been validated, for example, in French. It is specific for hand eczema. It assesses hand specific quality of life over the past 7 days, 30 items, 5-point NRS, and it measures, as you can see on this slide, symptoms, emotions, functioning, and treatment prevention. Validation has been done. It correlates with the LQI, correlates with other severity measures like PGA, a good test-retest reliability. The LQI, as all of you know, this is the most widely used questionnaire or quality of life questionnaire in dermatology, translated in more than 100 languages. This study looked at correlating the LQI questions to severity of hand dermatitis that is measured by the investigator, and some questions correlate very well, like pain and pruritus, shopping. Others, there were no correlation, like clothes worn or problem associated with treatment of skin. And interestingly, there was no correlation in this validation study with impairment of sporting activities. Finally, BOHEM, New Kid on the Block. It's a new questionnaire looking at burden of hand eczema. Validation has been performed for French and English. It is a questionnaire with 15 different questions. You have a list on this publication, and this is slowly starting to be used in clinical research. So in conclusion, there's really a need for a validated PGA, IgA tool that could be used in phase 2 and 3 studies for regulatory purposes. Lesion severity, XC, MT-LSS, and HEES provide different informations. Quality of life, QOL, HEQ, and the LQI being the ones most extensively used, and BOEM being the new kid on the block. Thank you.